in 2000, Anthony Luna suggested that last Sunday of every September should be celebrated as a World Heart Day. Cardiovascular diseases are most common cause of death globally. Empowering individuals to take better care of themselves is the best option as far as the community control and prevention of heart diseases is concerned. In very simple word, eat healthy, exercise more, and avoid bad habits. Uh, it's very easy to say, very difficult to practice. Prosperity in society goes in rise with health problem, as happened in USA, Europe, everywhere on the world, except Japan. Japan is the only country where people have become prosperous, but they maintain their health. Uh, I had a patient from a doctor from Tanzania for an operation about 5-10 years back. This man has practiced 35 years medicine in Tanzania as a physician. He never seen any heart attack patient, but he himself need bypass surgery because of his Indian lifestyle, diet, and everything. Just to emphasize the thing. Now, heart as a pump. We always compare heart as a jet engine of aircraft. Performance of the heart always compare with the jet engine. If it is properly maintained, never fails. The safest mode of transport today in the world is air transport, and that's because of the safety of the jet engine. I was taught that heart surgery is like a frying jumbo. We need multiple level of safety and backup plans in case of emergency. I'm associated with heart surgery since 1988 in city of Mumbai, Melbourne, Perth, Hamilton, visited Stanford Health, King's College London, and various conferences. What I've seen remarkably in last 30 years that heart surgery has evolved a lot and it has become one of the safest surgery available compared to the similar magnitude of surgery in other specialty. Major abdominal surgery or any other major surgery of any other specialty, heart surgery is the safest surgery. So don't worry, even if somebody has heart attack, we have modalities available, best modalities are available for treatment. I am fortunate to see the change over in last 36 year and experiences. Now I just give you some idea about what the work heart does. See, our body has got 30 to 37 trillions of cell, 80 organs, 86,000 neurons, which gives you tingling sensation here and there when there are problem, bone, muscle, and etc. There is a total vascular network of 96,000 kilometer in our body. The blood has to circulate through all this network, give oxygen to the cell, take all the bad metabolic product from there and give it back to the various excretory organs. That's how this process goes on and we live as a complete chemical factory. And heart is a major driving force behind it. So anything happens to the driving force, either this factory get weak or it stops suddenly, and that's how we see various things. This is a slide showing anatomy of the heart. The heart is in embryological age, heart is formed by a simple tube. The simple tube get twisted into figure of 8 and some part disappear, and that's how the complex heart form. So we say it right heart, left heart, this chamber, that chamber, but all this is so complex that conventionally we see that right and left. So you can definitely see the right side and left side. The left side is a contractile side, right side is a supplies to the lung, and left side supplies to the rest of the body. There are valves for unidirectional flow, and mainly heart is mainly consistent of average around 300 to 350 gram of muscle, which is supplied by a vessel which has got electrical activity. Now this next slide shows the various pressure in the heart chamber. From if you start from impure blood from the right side, the pressure is almost 0 to 6 millimeter of mercury. Then it goes to the down chamber, it gets raised to 15 to 30 millimeter. Then it goes to lung, and from lung again it is come back to left side in 6 to 12 millimeter of mercury. That's the average pressure. From that 6 millimeter, the blood falls down by relaxation of the heart and then push into the major pipe which goes into the rest of the body. So that 6 millimeter, the heart has to raise to 100, 110, 120 millimeter. This slide explain everything that how the hypertension affect heart, how the hypertension will affect, if you take into consideration that the pressure changes goes so much high from left side to right side, and from the left side in the back chamber to the main pumping chamber to the main artery. This is to show you the electrical system of the heart. This heart muscle has to have some rhythmic contraction for the activity to go on. So we got a superior most node called SA node. From there, the signal goes to AV node and to the rest of the myocardium. That's how the electrical activity goes on. And the third one is the fuel line of the heart, what's called coronary vasculature. There are two coronary artery, right side coronary artery and left side coronary artery. A lot of anatomical variation, but broadly there are two arteries, and they supply to the heart muscle in a major form, divides into smaller artery, ultimately to capillaries and supply each individual muscle fiber. That's how the network of the coronary artery. So we know what are the structures in the heart. So all these structures are depends on the blood supply of the heart itself. Heart supplies blood to the rest of the body, but heart has to supply blood to himself also, which is most important. If now the best the hal, hallmark of this disease is atherosclerosis, deposition of plaque into the coronary arteries. The deposition of fat-laden plaque into coronary arteries lead to narrowing of this artery. Whenever the narrowing goes more than 75%, there is a flow reduction and there is a reduced flow to the heart muscle. And that's how then the heart muscle behave in we get various complication out of it. We'll come to that. The best example is some of the kids are fed in childhood with sugar and milk, while some fed without sugar. The kids which are fed with sugar, they get small fatty streaks into their heart at the up to the age of 2 years. Obviously, once they start eating, then they out of milk, the fatty streak disappear. This gives a very beautiful example in nature that how dietary fat is responsible for fat deposit into the arteries of the heart. Then all this initially there are soft plaque, they go into calcification and become hard plaque. And when the plaque rupture, the problem comes. Stable disease, and there are two types of atherosclerosis. One is stable atherosclerosis and accelerated atherosclerosis. That explains that sometimes some people quickly progress to worse condition and some people remain stable for longer time of life. The most important called intima. As long as this lining is intact, no amount of plaque can produce any type of damage. Degree of plaques are developing, and in the last slide, the plaque has ultimately given up. The inner line has broken up. Once the inner line broken, the blood goes inside, and there is a natural tendency of this inner line contain electronegativity. That's how the blood never clot in the vessel. But once this inner line is destroyed, blood clot into the vessel, and we develop blood clot. And once so this is the atherosclerosis can develop into leg arteries, brain arteries, and the heart arteries, anywhere in the body. Where it will develop, and we really don't know. Every individual, sometime it will develop in legs, sometime will develop into the brain arteries, sometime develop into the heart arteries. So basically the management depends same wherever the atherosclerosis affects. Now, this is a slide showing how the heart attack happens. Once the plaque get rupture, the clot forms. Once the clot forms, the blood supply of the heart muscle is totally devoid, and the muscles suffer from acute ischemia. Once the muscle suffer from acute ischemia, that we call heart attack. The heart, depending on the degree of the heart attack, we can get various type of. When the vessels start giving less blood supply, we get chest pain. Then all the sympathetic system in the parasympathetic get activated. We get sweating, frightening, compressing type of severe type of pain. When the pump fail, then we lose blood pressure. If the electric system fail of the heart, then we get heart arrhythmias, and that's where there is a role of defibrillator. Everywhere you travel in airport and prominent public places, the defibrillator are kept in a glass boxes. So if you can save person, you can defibrillate somebody, the life can be saved. So that's how the electrical defibrillator works. In 1996, we had a change in heart surgery that before we used to do heart-lung machine, and after that we used to do direct heart surgery, but the intracoronary shunts were not available. So we used to do ischemic preconditioning, means voluntarily we used to pinch the coronary artery and see the action of the heart muscle. So I had a this was going on for a couple of years to train the heart to accept the ischemia when you do the grafting. So whenever you clamp the coronary artery, the blood chemistry starts changing very rapidly. Once the blood chemistry change, that's how we get the test positive. Troponin test is designed from that. When there is a microcellular necrosis start, the muscle and parasympathetic, all the system, the heart start getting bluish, the contractility start getting slowing down. And if you don't release that clamp at that time, then ultimately person can get heart attack. We used to call that, this was nice example that what exactly happened when the heart attack take place. So immediate help is the most important, lying down the person, taking him to nearest hospital and giving medicine. So this is how the heart attack happens, that whenever there is a clot get accumulated. Now, what are the risk factor for development of atherosclerosis? The main disease is atherosclerosis, but for development of this atherosclerosis, there are some controllable risk factor which we should able to control. Diabetes, hypertension, high cholesterol, smoking, sedentary lifestyle, obesity, anxiety disorder, and genetics. Some are controllable, some are not in our control. So we call them, those people are not in our control, we call them predisposing factor. Age, gender, family history, genetics, these are not under our control, but they are predisposing factor. That father has heart disease, so there are more chances that the kid will get it. Then there are risk factor which can be grossly easily modified. Smoking, yeah, 100% you can keep. Atherogenic diet, choice, you can have check. Alcohol intake, you can reduce it to the great extent. Sedentary life, you can increase it. Then there are metabolic risk factor, dyslipidemia, hypertension, obesity, and metabolic syndrome. So there are classes of risk factor intervention. Class 1 risk factor in cigarette smoking, LDL cholesterol, high fat, and hypertension. In class 2, there are diabetes, physical activity, HDL, triglyceride, obesity, and postmenopausal status. And psychological factor and family history of heart disease. This is the first factor will deal with blood pressure. Though blood pressure is just like a car accelerator. Certain desired pressure, the blood has to be get delivered from the heart chamber to the periphery of the body. So it needs certain pressure. If that pressure is lower, then the blood delivery will not be proper. Then we get fainting. If the pressure delivered under high pressure, then obviously the target organ, the small vessel will get damaged. And that's why the blood delivery has to be optimal pressure. With a lot of discussion and continuous monitoring, it has been designed that 120/80 is a optimal blood pressure. Anything more than 120 in higher pressure and 80 in the lower pressure is called hypertension. So high blood pressure. It is preventable. There are for some non-pharmacological method to control it. And if it not helping, then pharmacology is always there. Big drug industry is there. Nothing to worry. Treatment guidelines for blood pressure. Routine BP screening for odd adult. This is most important. 140/90 low blood pressure is for low risk patient. 140/80 for patient with already got established other diseases. All patients with blood pressure more than 120/80 should be screened for other problem. Then these are some medicines for hypertension. What are the challenges for treating hypertension? The incidence is rising rapidly. 40% of the people don't know that they have a hypertension. It just go unnoticed because there is no, as such, the symptom come when the disease is too late. So there is no symptom. So unless we check, and compliance of treatment is another big hassle. 1/3 of the patient only reach to the goal because compliance of the medicine, many people think that once the therapy started and the pressure is under control, they will stop the medicine, they will reduce the doses themselves, and all sorts of things happen. Now, we'll come to the most important and reversible factor responsible for atherosclerosis, cigarette. Cigarette smoking is, as the Western world, they are making a lot of smoke-free zone. The cigarette smoking is rapidly rising in developing world. And it will rise only. The cigarette company will advertise or they will percolate the market right that so that cigarette selling should go on. Cigarette is not a simple thing. You can see in this slide, there are so many compounds are there. All these are biochemical things which release into your blood. It not only harm your lung by the smoke, uh, the smoke is taken care by filter cigarette that they used to say when we shifted from BD to normal cigarette. But all these methanol, toluene, arsenic, butane, cadmium, all these element gets circulate into blood just like taking drugs. Smoking cigarette, this all this level will go into up into your system. They will damage your system, and once the levels are come down, the brain will get another kick so that you should keep on smoking. So it's an addictive process, and so many harmful compounds get circulated in the blood. Smoking doubles the incidence of mortality in CVD mortality. Risk increases with number of cigarette smoke and age of the person. Just to give idea, smoking causes so much death in the best example of smoking in natural history of means what happened in last century after the Second World War. This is a very interesting example that whether smoking is really harmful, you'll give an answer. In Second World War, as there was shortage of people, the ladies were allowed to fight the war. That change has happened in Britain, and they were allowed to smoke and drink. Once the ladies started smoking in the Western world, the incidence of smoke related diseases, which was 1 is to 8 in male as to female, has reduced to 1 is to 4. So this definitely indicate that smoking is a harmful activity. No other thing is required. If you quit the smoking, the risk reduces. After cessation, the risk approach to baseline in 5 to 15 years time. So, and smoking cessation is very costly, highly cost effective process. Uh, then the next is India is a diabetic capital of world. What is diabetes? Diabetes is a chronic metabolic disorder of carbohydrate, fat, and protein metabolism, clinically manifest in fasting hyperglycemia, means without eating any sugar, your sugar levels are high and you are passing urine in your kidneys with striking tendencies to a development of microangiopathy, nephropathy, and retinopathy. The basic hallmark of diabetes is alter your metabolism, means whatever you eat, diet, protein, carbohydrate, all those substrates should get converted into their final product and go to the cell, and the cell should utilize them to repair themselves and get better. And that's how our recovery goes on. So whole this metabolism get hampered and the cellular recovery is hampered. The microscopic vascularization of the body felt all the brunt of. So it's a basically microvascular disease. So wherever there is a very minute vasculature in the body, such as eye, brain, kidney, neurons, heart, uh, any microvasculature that get damaged, and you get complication of that. It is a type 2, we are talking about only type 2 diabetes. Type 1 diabetes, obviously you need treatment and it is just unavoidable. Type 2 diabetes is a lifestyle disease. Prevalence of diabetes is very high and is rising. And everybody thinks that once you take the tablet, the diabetes will disappear. But there are lot many things in earlier stages you can do to reverse the diabetes and to predict that if it has happened to at the age of 50, it will happen at the age of 60 or 65, 70. So you can prolong the happening of the diabetes. Uh, then next is obesity. Obesity in all, wherever there is a development and prosperity, the obesity incidence follows it. Now we are more concentrating on bariatric surgery. So you can see the amount of obesity in our society. Especially it is a truncal obesity, which lead to lifestyle diseases, insulin resistance, and diabetes, hypertension. Even modest weight loss improves lipid, glycemic control, blood pressure, and sleep apnea. there is little consensus on ideal approach to weight reduction. Failure rates are very high. Cost effective data is unavailable. Multifactorial physical activity, psychological support, pharmacological therapy, and bariatric surgery. These are the various options for. Basically, whatever the figures are available, they are of Western world. The Indian body size and Western body size, there is a remarkable difference. Our body size is more similar to Asian body size, so we should accept more Japanese figure, where the BMI of 23 is on 23 and above is higher, while Western society accept 25 because their body size is more. So we should be more have to have lesser fat than the acceptability than the Western society. Now, diabetes, hypertension, obesity, smoking, these all lead to development of plaque. In this slide, you can see how this cholesterol plaque get deposited and how they increase and reduce the lumen of the artery. Hypercholesterolemia. Treatment of hypercholesterolemia, anti-proliferative benefit of statin in addition to lipid lowering. Treatment of hypercholesterolemia is dietary changes, and second is the statin therapy. Statin therapy, despite she has control over the lipid level, plus it has got other benefit that anti-proliferative effect, antioxidant effect. Its lipid lowering medicine not only reduce the cholesterol, but they stabilize the heart plaque and they change the lipid content of the heart. So taking anti-cholesterol therapy for long term is a good option. The best way to reduce cholesterol, primary reduction, is through diet. You can see this slide on both sides. On one side, there are all naturally occurring foods are there, while on the other side, there are all synthetic. Whatever is packed, whatever can have a shelf life, this is all studied with chemical. Something is added to it to increase the shelf life. Basically, whatever human food is there available in nature has no shelf life. And the food on the right side, left side, they have got immense shelf life. So they are all bad food, increase the cholesterol. Same thing shown in the next slide. Even consumption of meat in smaller quantity is healthy, but usually people consume meat in larger quantity. That's why the major problems are there. But meat is also naturally happening. The God has given maximum survival option for human race. So it allows us to eat fruit, vegetable, as well as meat. Since meat is a complete food, it should be eaten in a very less quantity. Then, as the prosperity goes on, expectation goes on, more and more anxiety disorder, psychological problems comes. They also affect to the heart health. It's difficult to prove that there is any direct correlation, but that is one of the factor. Anxious disorder will lead to high blood pressure. So now another special thing, coronary artery disease in female. Up to the age of 45, coronary artery disease is very rare in women. Women who are less than 40-year-old, we even don't do their angiography for other cardiac surgery such as valve surgery or congenital surgery. We assume that their arteries are normal. After the age of 60, after the menopause, the gap between male and female become very small. After menopause, the LDL rises, HDL rises, insulin resistance increases, vascular function declines. So there are a lot of physiological changes in women after menopause, and they become more susceptible for coronary artery disease because of the smaller size of the coronary artery disease. About 10-15 years back, there was fad of hormone therapy, but now it has been proved that hormone therapy is no longer useful for prevention of coronary artery disease. Psychological issue should be sorted out. Depression, chronic hostility, social isolation, lack of social support are been consistently linked with coronary artery disease. Data intervention is limited, and there are not much studies to directly correlate it. Lifestyle affecting cardio, nutrition and diet. Uh, Recommendation are diet emphasizing vegetable, fruits, legumes, uh, whole grain, fish is recommended to decrease. Replacement of saturated fat with dietary and polyols can be beneficial to reduce. Diet containing reduced amount of cholesterol and sodium can benefit decrease of the risk. Diet in, emphasize to intake vegetable. Everybody knows what to do. Then, as a part of healthy diet, it is reasonable to minimize the intake of processed meat, refined carbohydrate, sweetened beverage to reduce the risk of heart attack. As a part of healthy intake of trans fat should be avoided to reduce it. Is difficult to avoid because socialization and food goes in hand. Everywhere you go, the cheapest food available is all this food, which is not mentioned not to eat here. Refined carbohydrate, beverages, sweetened beverage, these are all cheaper option available. So most of the places you will, unavoidable thing. So you should reduce as much as possible. Recommendation for exercise and physical activity. Adults should be routinely consulted in healthcare visit, optimize physically active lifestyle. Uh, it is advisable that one should engage in 150 minutes of activity per week, moderate activity, while 75 minutes of intense activity in a week. Even walking 3 to 4 kilometers or 6,000 steps, minimum 6,000 steps should be a good goal. For the adult who are unable to meet the minimal recommendation of activity, they can incorporate activity into their daily life and decrease their sedentary behavior to reduce the outcome. Circulating body BMI is recommended. Calculate BMI annually is recommended. Identify the overweight and obesity, and it is reasonable to measure the waist circumference to identify and those at higher cardio. Waist circumference is directly related to insulin resistance and development of cardiovascular diseases. In all adults with type 2 diabetes, tailored nutrition plan focusing on healthy dietary pattern is recommended to improve glycemic control, achieve weight loss. In type 2 diabetes, one should perform at least 150 same activity is recommended. This is what we should do when the HbA1c levels are more than 6.5. That initially you should do dietary counseling, try to improve healthy diet, incorporate exercise. Still there is no appropriate outcome, then you should start on drugs therapy. Primarily drug therapy is metformin and then others can be added to it. Recommendation for blood pressure that for a non-pharmacological method to reduce blood pressure means if you don't want to be on pill, you can try weight loss, healthy dietary pattern, dietary sodium reduction, dietary potassium supplement, increase physical activity, structure exercise program, and limit the alcohol intake. These are the non-pharmacological measure can be tried to reduce the hypertension. In adult with type 2 diabetes, hypertension, antihypertensive treatment should be initiated if the blood pressure is more than 130 or higher, with treatment goal to keep it less than 130. Adult with estimated 10-year risk more than 10% and systolic blood pressure of 140 with diastolic blood pressure of 90 or higher, initiation of use, lowering our medication is recommended. Now, take home message. The most important way to prevent atherosclerotic vascular disease, heart failure, and atrial fibrillation is to promote healthy lifestyle throughout. It's not 3 months program, 6 month program, but it is the way you live your life. Normally diet program, activity program, they are given some duration that you'll become healthy. And after that, it is not need something like that. But whatever you do, you have to maintain throughout your life in a whatever minimum maximum possible way. It should be the part of daily life than anything change for few days. After surgery, every patient relative will start, what about diet? The diet is not for 3 months, 6 months. Then if you tell them, give them dietary advice, they will keep on coming. Abhi sab theek ho gaya, now I want to eat. Whether should change their diet, um, it's difficult. A team-based care approach is effective strategy for prevention of cardiovascular diseases. Clinicians should evaluate the social determination of health and affect individual making their informed decisions. Adults who are 40 to 75 age are being evaluated for cardiovascular diseases and should undergo 10-year atherosclerosis risk estimation about clinician and patient discussion before starting pharmacological therapy, antihypertensive therapy, statin, aspirin, in addition to assessing for risk enhancing factor, can help to guideline the decision. Coronary calcium scanning can be a marker of uh, coronary artery disease. All adults should be emphasized on consume healthy diet, emphasize intake of vegetable, fruit, nuts, and ground, avoid refinement, sweetened beverage, overweight and obesity counseling, caloric restriction are recommended for achieving and maintaining the weight loss. Adults should engage in same in physical activity. This has come few times. Type 2 diabetes, lifestyle changes, dietary habit modification, achieving exercise recommendation is crucial. Metformin is the first line of treatment. Adults should be seized every healthcare visit. Tobacco use. All adults should assess at every healthcare visit for tobacco use, and those who use tobacco should be strongly advised to quit, and they should be helped with nicotine patches, and there is a standard program for this. Aspirin should be used infrequently in routine primary prevention of heart diseases. Uh, Aspirin should be used infrequently. Yeah, Cardiprin was about 20 years back. Pharmacological companies run campaign of Cardiprin, aspirin 50 milligram and prevent heart attack. Aspirin was widely sold all over the world, but there is no data available that taking regular aspirin without any risk factor is of any benefit for prevention of heart attack. There are more bleeding chances than other places. Statin therapy is the first line of treatment for primary prevention with elevated LDL levels and those who are diabetic. Non-pharmacological intervention are recommended for adults with elevated blood pressure. For those requiring pharmacological therapy, target blood pressure should be 130, less than 130/80. You can incorporating activity in daily life is one of the easiest method you can adopt. Activity can be as simple as brisk walking, taking not using elevator for 1 or 2 floor. If your office is on 5th floor, you can just go up to 3rd floor and walk 2 more floor. As the time pass on, you'll be able to climb 5 floor eventually. So endurance is more important, and things will improve. Mortality reduction benefits are also present in elderly patients who initiate exercise program. Exercise also reduce the risk of stroke and onset of diabetes. There is no large-scale randomized trial of physical activity in primary prevention. Secondary prevention, regular exercise reduce mortality by 25%. It recommended that 30 to 60 minutes of activity in most of the days for prevention of heart problem. Tomorrow is a World Heart Day. Living with currently in our society, we are living with disease on medication to prolong life. The life expectancy in last 50 years has gone up. At the independence 1947, when there was food shortage, the life expectancy was 49, 50 years. Now the life expectancy has gone above 70 years. But that 70 years, is not healthy life get prolonged. It is the people live with disease, popping pills, eating whatever they want, and so it is an unhealthy life. People are living longer, but they are not living healthy life. So you should focus more on living healthy life, less on pills. Aim is to live disease-free life, lifestyle modification, build healthy nation like Japan is a good example. Human body is a self-repairing machine. Given time, it repair itself. So if it is damaged, repair it. If it is not damaged, prevent it from getting into damage. Thank you.